Good afternoon, everyone, and welcome to Grand Rounds. For those of you in the virtual room, apologies for my late arrival. For those of you on YouTube, you can watch this anytime you like. My name is Tom Fard, and I'm one of the chair and organizer of Grand Rounds. And I mentioned in the email, it's always been our hope and intention that the Grand Rounds is as inclusive as it can be, and we've always said that it's a collaboration between the university and the NHS, and not just the medical school, but all the schools around the university. And you've heard from Roy McCrimmon just a couple of weeks ago how the impact that the medical school has both in its education and research arms, locally, nationally, and internationally. We've always welcomed medical students speaking at Grand Rounds, and we have a long history of hearing the Ronald Harden lectures, students talking about their elective projects, and occasionally we have people who not only come into Lions Den once but return for a second bite of the cherry, and that's what Sarah's doing today. She's spoken at Grand Rounds before, and she was in touch with me earlier in the I think it was the end of last year, to ask if she could have another slot to talk about another of her interests. The talk is called Patients Not Passports. It's very topical. You only had to turn on your computer or phone last week to know about Gary Lineker and his comments about migrants, immigration, and the furore that has caused and continues to cause. And of course, we're also in a week where down south, the junior doctors are striking for not just money but working conditions. And I think this all ties together to be a very timely talk, Sarah, for you to come and talk to us about. So I shall leave it at that, and just say a warm welcome to you. Thanks for coming back, and looking forward to hearing you talk. If you have any questions, please put them in the chat. We'll get to them at the end. Make sure you're muted. And Sarah, thanks very much.
Thank you so much, Dr. Fardon, and thanks everyone for coming. So yeah, my name's Sara, and I'm a final year medical student here at the University of Dundee. And before coming to clinical medicine, I was a medical anthropologist and I worked in global health and development. And today I'm going to take you on a whistle-stop tour of charging in the NHS and the UK's hostile environment policies, and hopefully convince you, if you aren't already, that part of our duty as healthcare workers is resisting these policies. Before I start, I just want to give a quick thank you to Docs Not Cops Glasgow, who are a campaign group based in Glasgow, who are also part of the Patients Not Passports network, and I just want to thank them for some of the content in some of these slides. So, just a quick, no, there we go. Just a quick outline of what we'll be talking about. The majority of the talk is going to be dedicated to kind of explaining what the hostile environment is and how it came about. I think this is really important because it is the majority of the work is really to understand these issues and in order to be able to fight against them, basically. So I think it's really important to understand properly what we're talking about when we talk about the hostile environment, and how it affects health. And at the end, I'll talk a little bit more in detail about the Patients Not Passports, which is basically, Patients Not Passports is a toolkit designed for campaigning, for educating about, and ultimately for resisting the hostile environment. So I'll talk a little bit about that and how people can get involved, and hopefully leave plenty of time for questions at the end. So moving on to our first slide. Now, this is a very busy slide, and I'm going to try and talk slowly so that people can maybe explore it while I'm talking. I'm only going to focus on the most recent and relevant things in what I'm talking about. But I really think to understand NHS charging, you have to understand the hostile environment. So what is the hostile environment? As a point of departure, I think it is important to say that the hostile environment is the official name for the collection of policies affecting migrants in this country. I've had a few people in the past ask or assume that it's a name given to it by activists or people who work with migrants or people who engage in this kind of work. It is not. It is a name of the official government policy. So that, as a point of departure, I think is important. And I'm going to focus on like I said, the most recent part of this. So the hostile environment was officially introduced by Theresa May in 2012. It was sold to the public as a way to make so-called illegal immigrants voluntarily leave the UK. And it has since been widely criticised as being cruel, ineffective, and also unlawful. It has led to policies such as deporting people before hearing their appeals, which was something that was highlighted by the Windrush scandal, which I'm sure most people here have heard of. And the hostile environment essentially introduced borders into every aspect of life in this country. So, for example, in education, by forcing teachers and schools to disclose certain information about the children in their care, into housing, by obligating landlords to do immigration checks on their tenants, and into banking by doing the same with banks, and also into healthcare. Its effect in healthcare, is essentially to exclude people from certain aspects of the health service. And by doing that, requires healthcare staff to enforce these borders within our health service. So, moving on to the next slide. If we're talking about borders, and so we're talking about borders in healthcare, again, there's a lot of detail here. And I'm going to try and speak slowly so that people can, if people want to kind of read the details of this, I'm also happy to send this around if people want to kind of focus on the details. And I apologize, I think this full screen mode is cutting out the very bottom line on this slide, but don't worry, that's the part that we're going to talk about, so that's fine. So again, lots of detail here, but I want to focus on two things. Firstly, how recent all of this is. If you look at all the dates for a lot of this legislation, it has all been introduced in the last few years, and therefore it can be undone. It's very, very recent. And I want to also focus on the main excuse that was used to justify the hostile environment in healthcare specifically, especially in the early years. So in the first few years of introducing the hostile environment policy into healthcare, health tourism was widely used by the government, essentially as a tool to manufacture consent for betraying one of the NHS's founding principles, which is that healthcare would be free for everyone at the point of use. This idea of health tourism was widely reported in the media. It was pushed by the government as a way to justify restricting access to healthcare. In reality, by the government's own figures, which they tried very, very hard to bury and not talk about, only 0.3% of the annual budget went on so-called health tourism. That is by their own figures. Those are the maximum figures they were able to come up with when they were trying to justify pushing this line. So that's something to bear in mind. 0.3% of the budget, when this excuse was used widely to push this policy. And a lot of the research shows, apart from the fact that it's only 0.3% of the budget, a lot of the research shows that providing preventative care is not only more humane, obviously I think we can all understand that, but it's also more cost effective. So this policy was not even doing what the government officially said it was designed to do. And I think that's a really important point to highlight and think about, because once you understand that this policy was not doing what it was meant to do, and that the government has always known that it's not actually doing what it's meant to do, you kind of begin to understand the hostile environment for what it really is, which is part of a wider ideological project pushing this country towards racism, towards exclusion of all kinds, and away from care and community. And I think that's really, really essential point with understanding the hostile environment, is really, really looking deeper and trying to understand how it is part of this wider project that is damaging so many parts of this country in so many different ways. And, you know, in this case, the most visible victims of this are obviously migrants, and they are definitely the ones we need to be talking about the most, but it does ultimately hurt lots of other things and lots of other groups in this country. So once you understand this, I think as healthcare workers, we really have to ask, do I want to be part of this wider project? And I think we can even go further than that and ask ourselves if not being part of this project is actually a professional imperative once you understand what it is and what it's doing. I think this is especially obvious when looking at some of the impacts of borders in healthcare. So, the public health impacts, I think, are fairly obvious and visible, but these policies widen healthcare inequalities. They deter vulnerable patients from seeking treatment. They make them afraid to go to the doctor because they are afraid they will encounter the border in the GP clinic or at the hospital. It encourages racial and ethnic profiling in hospitals. There's been an awful lot of research about this, the racial and ethnic profiling in hospitals. And it determines what treatment you get based on your ability to pay and not on your clinical need, which is never what we are taught as medical students and as clinicians. So I think it's important to keep all these impacts in mind. And Patients Not Passports, the Patients Not Passports campaign group is actively fighting against this in lots of different ways, which are all listed on the slide and which we will come back to at the end. I just want to quickly take a look at what this looks like in practice, because I think this is really powerful. I've got a couple of testimonies here. These are all publicly available testimonies collected by Doctors of the World. Doctors of the World run a clinic which is freely and openly available to everyone in London. And they have, for a long time, done quite a lot of research into the hostile environment and its effects on migrants and migrant healthcare. So this first testimony is from Maria, who feels it's not safe to go to the doctor despite a breast lump. And then when she finally is able to access primary care, she is then scared to go to hospital. And this is quite a common story. Both parts of this story, so both being afraid to access primary care and then perhaps being able to access primary care and then being afraid to access secondary care. It's also the case that a lot of people within the healthcare system do not fully understand how these immigration checks work and how these exclusions work. And I think this is probably at least partly by design, because things like primary care, for example, even with all the restrictions that are currently in place, primary care should still be available, but many GP surgeries don't know this. And so they do exclude people who actually have a right to access care. And then this becomes a self-reinforcing cycle because they exclude someone who then will go back to their community and say, oh, well, when I tried to register with the GP, I wasn't able to. And so then other people in their community think, oh, well, I don't want to risk it. And so people don't go and they get sick. The next one is from Patricia, who is 6 months pregnant, but has had no antenatal care. I don't know if there are any obstetricians in the talk at the moment, but I'm sure if there are, that's a very scary thought. She's worried her bump is too small, but she's worried if she goes to seek advice about this, she'll be deported away from her British partner. And that's also something that a lot of people don't understand. A lot of people read this and say, well, she has a British partner. Surely she's safe. She can't be deported. This isn't true, because as another aspect of these wider controls on immigration and strengthening of border policies that the UK has been moving towards for the last several years, partners of British citizens are only entitled to live with them in Britain if that British citizen is earning more than £18,600 per year. So from this story, we can assume that Patricia's partner is earning less than that, and therefore she is at risk of deportation, and it does happen. There have been many, many documented cases of people, even people with children, who have been deported either with their children away from their British partner or deported away from their children. But it has happened and does happen. So this is a very logical fear on Patricia's part. So that's for the context. I promise this gets more hopeful in just a couple seconds. So I really hope that the last few slides have provided kind of a good overview of the wider context, and they've been interesting. And importantly, what I really wanted to highlight here is how recently this has all been done, and how it could all be undone, and how we can resist it, which is what's coming next. So, patients, not passports, what can we do? The good news is the first step you've all already taken the first step, which is to understand. I really think this is so important for people to understand where these policies come from, how they're put into action, and why they're put into action. The next part is raising awareness. Talk about this. Talk about it to your friends. Talk about it to your family. Talk about it to your work colleagues. Talk about it to anyone who will listen. That's what I do. Anyone who knows me will know that I'm always talking about this, because I think it's so important, and because so many people don't know what's happening, and every other person that you speak to is another person who can take action. So, and who can tell another person who might take action, etc., etc. You all get the gist. So I think this raising awareness part is really important. And the third thing you can do is to take action. You can make your surgery or clinic a welcoming place for migrants. There's loads and loads of resources for how to do this online at the website that's indicated here. The Patients Not Passports Toolkit is fantastic. It has been put together by a group of super dedicated people. It is really well researched, really well resourced. I highly recommend taking a look around. And there are resources there to help you make your place of work more welcoming for migrants. You can also contact your MP and or your local NHS trust, asking them where they stand on migrant charging, and if they would stand against it. You can get together with other people to do this in a group. It becomes a lot more effective the more people are doing it. There is a lot that can be done. I am very happy to be emailed. We've got a petition at the moment for a young girl called Omisha, who has been denied, well, she's not been denied care, she's been charged tens of thousands of pounds. She is, I believe, 2, for life-saving treatment for a very rare form of cancer. And she needs support, her family needs support. So there's a petition going around. I'm happy to send it around to people who are at the talk after this, if people want to email me. I think we're all on the NHS Tayside network, so I think you can all find my email through that. There are always new joiners meetings happening every few weeks. They're very welcoming. We're always really happy to see new faces and to build new groups to help people with resources, whatever they might need. It's a really fantastic group of people, and I highly recommend the new joiners meeting. And again, if you have any questions about that, please feel free to get in touch with me. I'm very happy to signpost or chat through things or anything you would like. And I think that brings us to the end. So I'm happy to take questions. If people have any questions, please feel free. I'm all ears.
Thanks very much, Sara. And I mean, this is a really interesting area, and obviously touches it's very political with a big and little p. What were your thoughts? I mean, you mentioned to me and in the email preamble about the Gary Lineker thing. Do you think that do you take the view that any advertising is good advertising, and that just it being in the news is a good thing to get people talking about it, or do you think that it has created schism in society, and that we really do have these two warring sides of folk? What do you think's been the impact of that? If you've got a view on that.
Yeah, that's a big question. I'm just trying to make sure I understand fully what you're asking. you're asking if, for example, the recent scandal with Gary Lineker, is that what you're asking?
Yeah.
Or, yeah.
Yeah. Do you think that was a good thing? I mean, is just the fact that people are talking about it at all, do you think that's a good thing and is helping the cause, or do you think that it's such a divisive topic that actually there's as many people on the opposite side as there are on his side, and it's made things worse?
I think probably on balance, the Gary Lineker debacle, I don't really know what to call it, was a good thing. I struggle to call it a good thing because none of this should be happening in the first place. But yeah, I think probably it's almost always helpful for causes when people with large platforms and large followings speak up. So I think that's a really good thing that happened. I'm not going to pretend I really knew who he was before this, but I understand he was an establishment. So I think probably yes, but I think also there are things about the UK that I'm very unfamiliar with, so probably not as able to judge the impact. But I understand I mean, pretty much everyone knows who he is, and he's a household name. So, and that in that sense, it's good that he raised his voice, and I think it's important for people to do so, especially when you know, we've got a system that is really, really rapidly gaining steam as a pretty effective tool for discrimination and exclusion. And I think the more people speak up against that and the more people act against it, you know, the better, definitely.
Well, I'll skirt over that you didn't know who Gary Lineker was. That makes me feel very, very old. But there are some hands up. Let's start at the top of my screen with, I'm sorry, all I know you by is by your handle. So Sara Lily.
Hi, yeah, I was just wondering, that was like a very, very comprehensive and like I think a good kind of overview of everything with the Patients Not Passports kind of campaign. I was just wondering, I know you mentioned a few things like getting in touch with local health boards and things to see where they stand and things like that, but I was wondering if there's any sort of things that we can do within our F1 year for those of us graduating, or F1 and F2 as kind of junior doctors in the hospital, on the ground, like within our workplaces, if there's anything that we can do to kind of, as the most junior people in the hospital, to push back against the hostile environment.
Yeah, so that's a great question. And something, you know, I've been thinking about quite a lot because I'll be graduating very soon. And I think a lot of people are thinking about it. So I think the most important thing is to join up with the campaign. So get in touch with the campaign, come to a new joiners meeting, and, you know, see who's involved, get to know people, and then you will be, if they know people in your area who are part of a Patients Not Passports group, or there's also kind of a separate but related organization called Docs Not Cops. They will know if there's a Docs Not Cops group in your area. They will know if there's a Patients Not Passports group in your area. They'll be able to hook you up with them. So definitely do that. And I think the other really important thing you can do is to educate yourself about all the different aspects of resisting these policies. Again, I sound like a broken record, but the Patients Not Passports website with a toolkit is really useful. There's a whole section for healthcare workers, and there's a section with like key arguments of the campaign, so you can talk to people about it, you know, armed with the relevant information. And I think that's really important as well, because just questioning it, I think in healthcare so often, you know, we live and work by protocols, by algorithms, which are incredibly useful and important, especially in you know, high stakes, high stress situations. But it can sometimes lead to a computer says no mentality. where people just go, oh, I don't know why I need to see her passport. I just got told by the person above me, who got told by the person above them. And that just gets passed down the line. And people don't actually really understand what they're doing. They're just doing it. And if you just ask a question, you kind of interrupt that cascade. And that can be really, really powerful. And in order to do that effectively, all you need is some information. So I would highly recommend getting informed and getting involved as a way to empower yourself to question these policies.
Thanks so much. Simon, is it Cribbs I'm going to go for? Simon Cribbs?
Close, Cribbs, but
Apologies.
I was just wondering if, I know you kind of touched on this, Sarah, but do you think there's any like specific groups or populations that are more affected by this policy and these policies than any others?
Yeah, there definitely are, I think, groups that are more vulnerable. Obviously, everyone who doesn't have so-called legal status is vulnerable to this policy. But I think it's particularly worrisome for people who need ongoing care, because technically, legally, emergency care is still freely available. Again, because it's very murky and these policies aren't very well explained, sometimes emergency care is denied, and that has been documented. But technically, emergency care is still free at the point of use. But if you need care beyond what is emergency care, and this is where these policies are really forcing us to use our clinical judgment in ways that it shouldn't ever really be used, and in ways that it's very tricky to use, because technically, you know, everything's an emergency if you leave it long enough, which is what this policy encourages healthcare workers and patients to do. If you have a problem that could be solved in primary care, but you leave it a year, 2 years, however long, it then becomes an emergency problem. And that is how this policy really creates ill health for people. And so I think some of the most vulnerable groups are the people who need ongoing care. Pregnant women are particularly at risk, because obviously in pregnancy you need like a close follow-up, and 99% of the time everything's fine, but that 1% of the time where it's not can be very, very risky. And there have been, it's been very well documented by Doctors of the World, large quantities of women, especially in London, but I don't actually know if it's especially in London or if it's because their research is mostly based in London. That would be a good thing to find out. But definitely there's a lot of women in London who are going under the radar of healthcare services and going pretty much their entire pregnancy without any kind of antenatal care, which is very dangerous. And I would also probably argue that it's especially risky for children, because there are children who are living in this country undocumented, and they are especially vulnerable for a number of reasons. So yeah, there's a lot of groups that are especially vulnerable to this policy, but technically it's everyone who doesn't have so-called legal status.
I have Atty.
Hi, I'd just like to thank you for that talk. I thought that really, really interesting. And I've got kind of a similar question to earlier. As a medical student, obviously we often don't have a lot of role in terms of clinical work, but is there any way we could get involved and support the cause in any fashion?
So I definitely would recommend getting involved as a medical student. Again, if people want to email me, I'm very happy to be contacted, very happy to chat, happy to put people in touch. The Patients Not Passports campaign welcomes medical students. There are active medical student groups in England and Wales, I believe, at least a couple of universities. So definitely students can get involved and should get involved, because it prepares you better, I think, for graduating and then being able to challenge this when you're working. I would also say, as a student, keep a close eye on teaching materials, and I don't just say this, I'm not pointing the finger at Dundee University, you know, wider teaching materials like the PassMed and other things where questions are written. And I have, in the last 5 years, come across various instances of questionable question constructs. And I think you can always challenge that. And I have done. And I think a lot of the time, these things end up getting through, not because people are horrible and don't want migrants to access healthcare. It's simply because that is now the official policy. That is now the official line. And like I was saying earlier, in healthcare, we use a lot of algorithms, a lot of protocols, and people just go down the line. They just do things because that's what I was told, and it is cases like this where you see that attitude sometimes can be detrimental. So definitely, I would say, if you see things in the wider curriculum, not just the curriculum you're being taught by the university, but in the wider curriculum that you don't agree with, speak up, say something. And if you're not sure how to do that, again, I'm very happy to be contacted. I've done it a few times. And I think it's always worth doing, and not only contacting whoever published the said educational material, but also talking about it to your peers, because while you may notice something, one of your classmates might not, and it's not because they're a terrible person. It's simply because no one has ever brought this up to them before. And I think if you can question that in front of your peers and around your peers, then again, you're doing what I was saying earlier about raising awareness and helping people to understand. So there's lots and lots of different ways. I would say challenge things whenever you see them. Use the Patients Not Passports toolkit to do that. It really does empower you to understand these concepts and to communicate them in an effective way. And join up with other people. There's strength in numbers, and it's always nice to know and understand that there are other people who are very committed to this. So yeah, I hope that was helpful, but feel free to get in touch if you want any more guidance or anything.
And then my co-chair, Leslie Crichton, has a hand up. Hello, Leslie.
Hello. Hi, Sarah. Thank you very much for an absolutely eye-opening talk, as always. I just wondered if you knew, obviously, immigration policy isn't devolved, so the Scottish Government will have very little control over what happens here. But I wondered if you knew whether there were any differences in the way that this was happening in the NHS in Scotland as opposed to the rest of the UK.
That is a great question, and it is one I've been asking for quite a long time. And the vast majority of the research does seem to be based around England. And as far as I know, the last time I actually properly looked into this and asked and checked, which was probably about a year ago, there was still not a clear answer about the differences. So we know that, yeah, health policy has evolved, and we know that definitely there are less people being excluded from less services in Scotland than in England. What we don't know is the precise differences between the two. So we don't actually have, as far as I know, numbers or a kind of a specific areas that people are being more or less excluded from, or specific areas in Scotland where people are being more or less excluded. But we definitely know that it is happening in Scotland. I may or may not be doing some research into this over the next year or two. I've just got confirmation that I'm staying in Scotland for my F1 and F2. So I was waiting to find out if I was staying or not in order to figure out whether I might actually do some of this research. So it is information that can be found through freedom of information requests, etc., etc. But as of now, I'm not actually able to properly answer that question. But thanks for asking. It's very important. And I think it's an area that urgently needs to be clarified within the campaign.
Thank you.
Any more questions? I'm just searching the chat. Nothing in the chat. This is very thought-provoking stuff, Sarah. Your talks are always that, and I think challenges us to think about. Are we helping? Or are we part of the problem? We're part of the solution. What can we do in a small scale to change things? We can't all make massive changes to things, but we can all do our bit. And how can we do that? So I think it's very an excellent talk and very thought-provoking. And speaking of doing your bit, he says, segueing seamlessly into an advert, the university is just about to enter into exam time, and we are very desperate for OSCE examiners. So here is, to make it as easy as possible for you, here is a QR code that you can just scan with your phone. It'll take you straight to the registration site to register for OSCEs. I'm told we're a couple of hundred slots shy for OSCE examiners over the next little while. And if you are listening and you are a doctor and you are 2 years post full registration, whether you're in a training program or a clinical fellow working in general practice or in the hospital, then we'd love to hear from you. You can examine not necessarily everybody, but at different stages of the curriculum. So please do this, zap the QR code, and please register to go and be part of our OSCE examining faculty. I've done this for years. It's very interesting, actually, and I think if you've not done any OSCE examining, that you'd be very pleasantly surprised about the caliber and quality of our medical students. They really perform exceptionally well under very stressful situations, and I think if you can do a range through second year through to fifth year, you see a really dramatic change of these young people coming through to be doctors. And speaking of QR codes, if you would like to get a certificate to say that you've been to this grand round, or indeed any grand round, then you can scan this QR code that's now on the screen, and this will take you automatically to our registration site, where you can register that you've been here, whether it's virtually or you're watching on YouTube, whether it is 2023 or you're watching this back in 2035, you can still get your certificate, and it also goes on our records so we know what you're up to. So please scan that as well. Next week, Rory McCrimmon returns, not as the Dean of the Medical School, but as a researcher in type 1 diabetes. He's going to speak about innovation in type 1 diabetes. We heard all about type 2 diabetes from Ewan Pearson last year, and it's type 1 diabetes next week. The following week, sustainability, the plastics recycling project here in NHS Tayside with Pavan Bangalore. You get a week off for Easter, and then some serious business on the 13th of April, where the pharmacy team are going to talk about HEPMA, the electronic prescribing system. So a very important bit for that. And we do have talks into April and May. We've got slots on the 25th of April, 1st of June. What am I talking about? 25th of May, 1st of June, and then every date in July. So if you're sat there thinking you've got a great talk in your back pocket, please get in touch and I can offer you a slot. Sarah, thank you very much for the talk. As I say, excellent stuff, very thought-provoking. Anyone wants to talk to Sarah, if you get in touch with me, I can filter through the messages to her, or I think she may even put an email address on the screen, but contact me, very happy to help get you in touch with Sarah if you want to champion this cause. Thanks, everyone. See you again next week. Have a good weekend. Take care.